Good day everyone, I'm Raffaella Viti, Health Economics Manager for Takeda, and I will present you the budget impact analysis of Brigatinib for second-line treatment of ALK positive advanced non-small cell lung cancer in Italy. Here, a brief introduction. First, I will give you the background to understand the context, then the methods used for this analysis, the results, and then the conclusions. So let's start with the background. In Italy, lung cancer is one of the leading causes of death, with non-small cell lung cancer accounting for 80 to 90% of all malignant neoplasms. Several genetic alterations have been identified, including ALK, which account for approximately 3 to 7% of all non-small cell lung cancer. The prognosis of this disease is changing with the availability of next-generation HTAi inhibitors used as second-line treatment to overcome crizotinib resistance. First generation, for example, crizotinib, and second generation, for example, alectinib and ceritinib, therapies are available for this patient. Brigatinib is a new treatment option reimbursed by Italian NHS for the treatment of all patients with ALK positive non-small cell lung cancer who have previously received crizotinib-based therapy. Therefore, a budget impact model was developed from an NHS perspective to assess the impact of the introduction of Brigatinib on the Italian budget over a 3-year time horizon. We compared two scenarios, one considering only the current treatment reimbursed in Italy for patients eligible for second-line treatment, alectinib and ceritinib, and a scenario in which Brigatinib is reimbursed, which gradually replaces alectinib and ceritinib. In year 1, the number of ALK positive non-small cell lung cancer patients eligible for ALK inhibitors was determined using a mixed incidence prevalence model. A progressive increase in market share for Brigatinib of 23%, 26%, and 31%, respectively, over 3 years was estimated. Resource use varied according to 3 different health states: progression-free, after disease progression, death, and a partitional survival model was used to allocate patients across health states. The relative effectiveness of the available treatments was estimated using the match-adjusted direct comparison method, based on the results of clinical trials of the drugs included in the analysis. Unit costs were obtained from the official Italian drug price list, guidelines, and published literature. Costs included were drug acquisition for the molecules studied, drug acquisition and administration for oncological follow-up therapies, drug acquisition for concomitant therapies, specialist visits, monitoring visits, adverse event, and hospitalization and palliative care. Now, let's look at the results. On this slide, we see the estimated eligible population. The target population for the second generation inhibitors ALK was estimated to be 308, 354, and 360 at year 1, 2, and 3 respectively, including both incident and prevalent patients. ALK positive non-small cell lung cancer patients treated with Brigatinib in second line corresponded to 71, 87, and 108 11 over 3 years, respectively, according to the market share of the molecules. The NHS expenditure in this scenario without Brigatinib was 18.8 million euros in year 1, 11.9 million euros in year 2, and 8.3 million euros in year 3, compared with 17.8 million euros in year 1, 11.7 million euros in year 2, and 8.4 million euros in year 3 in the new scenario. As you can see from the graph, the introduction of Brigatinib is expected to reduce NHS expenditure by a total of 1.1 million euros over 3 years. A cost saving of approximately 900,000 euros in year 1, 200,000 euros in year 2, with an increase of 47,000 euros in year 3. Specifically, the increase in the use of Brigatinib resulted in the proportion of treated population remaining in progression-free disease increasing from 7 to 28% at the end of 3 years compared to the scenario without Brigatinib. Drug acquisition and palliative care costs were the main drivers of saving. In conclusion, Brigatinib is a cost-saving option for the Italian NHS as second-line treatment for ALK positive non-small cell lung cancer that may improve patient outcome compared with the other available therapeutic options. Efficacy and safety benefit of Brigatinib may lead to a higher number of patients without progression or post-progression and a lower number of deaths. Thank you very much for your interest. If you have any questions, please do not hesitate to send us an email. I'll be happy to answer.